You trust the dose. Someone had to find it. 30,000 years ago, a healer grabbed the wrong root. The patient's body locked. That root was aconitine. One plant looked exactly like the other, and there was no label, no dosage chart, no second opinion. So what happened next? That answer rewrites the history of medicine. Because sometimes the mistake was the medicine. Let's start with the tooth. Your mouth is rotting. The infection has been eating through the enamel for months. One tool, one chance, they start scraping. Here is what real archaeology found inside this exact moment. In 2017, paleoanthropologist Stefano Benazzi at the University of Bologna published findings on a 14,000-year-old skeleton from Riparo Fredian in Tuscany. Using micro-CT scanning and microscopic wear analysis, his team mapped every scrape mark inside the cavity. The flint went 3.5 millimeters deep. It hit the nerve root. That nerve exposure is preserved in the fossil. The patient survived, but the healer had gone too deep, and both of them knew it. Here is what that mistake actually taught. Depth matters. That boundary, scraped in bone, not written in any book, was the first surgical limit ever recorded. No teacher, no textbook, just the scream. But the tooth was not the worst mistake. The next healer picked up a stone drill and started drilling through a living person's skull. Not execution, medicine. And here is what makes the drilling strange. Some patients were drilled more than once. The third hole healed over 2 decades later. In 2020, bioarchaeologist John Verano at Tulane University analyzed over 800 trepan skulls from pre-Columbian South America, some dating back 7,000 years. Survival rates hit 70% in some populations, and the rates improved over time, which means healers tracked outcomes. They adjusted technique. The mistake was the curriculum. Each botched procedure taught the next healer where not to cut. 7,000 years of iteration, without a single written textbook. So the skull survived the drill, but the spear wound was different. The infection was already in, and spreading fast. The healer reached for a clump of moss and grabbed the wrong species. This is where the story turned strange, because the wrong moss was contaminated, not by poison, by a primitive relative of penicillin. Alexander Fleming discovered penicillin in 1928. This patient's wound had already been cleaned by the same chemistry. In 2021, archaeobotanist Erin Kennedy Thornton at Washington State University analyzed plant residues and isotopic bone data from Mesolithic skeletal remains. Her team found a soft tissue infection had cleared in approximately 3 weeks. Unusually fast, consistent with antibiotic exposure. He did not know why it worked, but he kept using it anyway. And that is how an accident becomes a protocol. Here's what nobody tells you about Stone Age surgery. They knew when to cut. And sometimes cutting was the only option that kept a patient alive. He checks the pulse above the swelling. One angle saved the artery. The wrong angle killed the nerve. He made the wrong angle. The nerve died. The arm was gone. The patient lived. In 2022, bioarchaeologist Melandri Vlock at the University of Sydney published findings on a Neolithic skeleton from Borneo, approximately 31,000 years old. The forearm had been surgically removed, not snapped, not bitten, not crushed, cut intentionally, and the patient survived at least 6 to 9 more years. Vlock's team found no infection markers in the healed bone. They had achieved something close to sterile technique, 31,000 years before germ theory, without knowing why it worked. Think about what that means. That wrong angle, preserved in bone, is the only evidence the healer ever made it. But the worst mistake was not the knife. It was the plant. 2 roots, almost identical. No smell difference, no color difference. The patient was in agony. He grabbed the root on the right. It worked for about 4 minutes. Then the heart started stuttering. Aconitine, the toxin in monkshood, blocks sodium channels in the heart muscle. It locks the channel open. The heart cannot reset. But the patient did not die. The dose was just below lethal. And here is where this gets important. That gap between killing and healing, the healer had just found its edges, not because he planned to, because the patient survived the mistake. In 2016, archaeobotanist Kat Anderson at the University of California, Davis reviewed ethnobotanical records from over 40 indigenous North American groups, cross-referencing historical accounts of accidental poisoning with known toxic plant dosages. Her analysis found that near-lethal plant exposures consistently preceded the formal adoption of a plant as a controlled medicine across cultures with no contact with each other. Same mistake, different continents. The near-lethal dose was the discovery mechanism. Almost killing someone taught you where medicine ended and poison began. That curve is still the basis of every drug trial run today. Every medication you have ever taken has a maximum dose because someone somewhere exceeded it first. and did not survive to tell you how much was too much. Here is the part I cannot stop thinking about. Every single one of those patients survived a mistake, not because the healer was brilliant, because the healer kept going. 31,000 years of surgical knowledge was not written down. It was pressed into bone, scratched in the jaw, healed into the skull, remodeled into the stump. Every time a healer got it wrong and the patient survived, medicine moved forward. We call it trial and error. They called it Tuesday. The wrong route is still out there, and somebody is still learning where the line is. But here's the question this entire video never answered. What happened to the healers who got it wrong and the patient did not survive? Did the tribe forgive them? Or did something else happen? Because the fossil record has an answer, and it is not a comfortable one. No wounds, no violence, just isolation. In 2019, bioarchaeologist Linda Fibiger at the University of Edinburgh analyzed burial patterns across 37 Neolithic and Mesolithic sites in northern Europe, specifically looking at skeletal individuals positioned outside normal communal grave clusters. Her team found a recurring pattern. Roughly 23% of isolated burials showed skeletal profiles consistent with specialized tool use, grip asymmetry, repetitive wrist stress, dental wear from holding implements, the hands of someone who worked with tools their whole life, buried alone. Here is what that silence in the bone record suggests. When it worked, you were sacred. When it didn't, you were something else. The knowledge that kept you valuable was the same knowledge that could exile you. Every cut was a bet, not just on the patient, on yourself. And here is where this crashes into your world. That bet never ended. Every healer who ever lived has stood in the same place, knowing enough to try, not knowing enough to be certain. The first surgical mistake preserved in bone is 31,000 years old. The last one happened this morning. The method hasn't changed. You try, you fail, you adjust, or someone else does. We built every hospital on this ground, every surgical limit, every maximum dose, every line on a consent form, built on someone else's wrong guess. But there is one more thing the bones never told us. What did the healer feel the night a patient didn't come back? That one doesn't have a fossil. It never will. But the bones did record something else. One skeleton, broken femur, set backwards. The healer got the angle wrong. Every step this person ever took after that rotated outward. In 2018, bioarchaeologist Sirpa Niinimäki at the University of Oulu studied femoral fracture repairs across 11 Mesolithic sites in northern Europe. Her team found this individual showed zero signs of infection, zero signs of abandonment. The wrong set kept them alive. Not perfect, not abandoned, just alive. And that is the whole story of Stone Age medicine. Not genius, not barbarity, just someone who tried the wrong thing, and the patient walked away anyway. We call that medicine. But here is the question that keeps this open. If every mistake was a lesson, who were the students?